Hey guys, we want to jump back in and discuss PANDAS and PANS. And a really important aspect of these conditions is the fact that they are an abrupt, acute onset, but they also have a triggering event that elicits that acute onset. So a triggering event for PANDAS patients is that streptococcal infection. So kiddos are exposed to strep and this symptom set happens. For PANS, it's a little bit different. So for our family, our daughter had a tick bite, a mold exposure, and about a food poisoning, all within a 2-week span. So poor thing, she had a lot of, and we don't know exactly what the triggering event was for her because...
And it doesn't matter.
Yeah. But you need to know that it could be many different things. Other pathogens, even volatile organic compounds and other environmental toxins and other infections can cause these symptoms and fall into that PANS category.
Yeah, so when we have these triggering events, we need to then figure out, okay, there's a child that's suffering. How do we go about testing and trying to understand? There's no definitive diagnosis for this condition, but we talked about that there is an autoimmune response to the brain. So there's a couple of great tests that exist out there that is actually looking at, does that child or person have an autoimmune response against various tissues in the brain? So there's immune system dysregulation. The two tests that exist out there are the Cunningham panel from Molecular Labs. It's an awesome test. It's a really expensive test. It's over $1,000, but there's a lot of research that has been done on that particular test. There's a recent article in the Journal of Neuroimmunology looking at that specific test. Great information about that. There's also one that's a little bit less expensive that we happen to use called the NeuralZoomer Plus from Vibrant Wellness. And so a couple of different options for beginning to understand if there's an immune response against neurological structures. If there is a positive response on those tests, that is not definitively diagnostic for PANDAS or PANS. However, there's some other blood markers as well that could shed light on, are there strep antibodies that are present, other inflammatory compounds that are present in the blood that might be really continuing to paint that clinical picture of this is a child that is suffering with that. So things that we can be looking at there, but the key is it's an immune system dysregulation. So we need to remove those triggering elements. And so we've got to get that immune system calmed down. Conventionally, there's a lot of treatments that different practitioners will utilize for that. It can be plasmapheresis, immunoglobulin therapy, a lot of other...
Removing tonsils if strep.
Yeah, tonsillectomies for removing if recurrent strep infections are a thing. I had one patient who, they'd never had a negative strep test in their life, and the kid was around 6 years old. And as soon as we started working on some things, he never had strep infection after that. So we sometimes need to look at removing the tonsils depending on the child. However, there's also a lot of various herbal remedies that can be utilized as well to help to modulate the immune system and get that to be working properly, but also acting from an antimicrobial level. In this particular journal article, those who received actually antimicrobial therapies ended up typically having a better response rate than even those who had received some of those other conventional, plasmapheresis, other treatment options that way. So there's a lot of different options, but you do need to find a doctor of some sort who is aware of these conditions, has access to these tests, and knows then how to go about treating and working with that child to get them into a good spot. But
maybe I'll give an example just for our daughter. She, we had Lyme as an issue and we had mold as an issue. For her, we needed to specifically detox that mold from her body. It's a significant and really specific process that goes into that. We had to modulate her immune system and get her immune system built up so that it could fight the Lyme, and we had to go in there and deal with the Lyme. So for her, removing those things and then restoring membranes. So there's typically a leaky gut involved, a leaky blood-brain barrier, there's intimate connections there, so restoring those barriers and decreasing inflammation. There's so many pieces here, but just to give you an example, all of those things that I mentioned that we did for our daughter, we did naturally, and we didn't have to go and, you know, obviously remove tonsils and you know, even do antibiotics and things like that, because it wasn't necessary. And the natural remedies that we use are very powerful.
Yeah, and so at the end of the day, know this, that there's hope, there are answers, and there's ways of beginning to look into these things in a different way, even if the pediatrician who's involved in the care is not necessarily buying into it. So there's hope, there's answers.
So much hope.
And we can help you here.